symbolic part, like as I told you, clap or maybe the hands up, and type your doubts and queries only in the chat box rather than preferring the verbal thing. What happened when you type in the chat box, we'll be able to see that very clearly. We'll be framing the question. Many a times the questions are repeated, and many a times people are not asking questions. Their questions are answered. For me too, since I have been doing yoga for about 15 plus years. Of course, not irregularly regular, but water yoga was something very new and very unique, and personally I liked very well. Sir is expert upon that. Welcome you, sir, on board. And whatever I say about you, it is maybe the whole conference hour will be less to detail about both of you, because you are so enlightened that 1 hour will be too less to detail about. So it's a minor introduction. My Rehab Academy, on behalf of My Rehab Academy and our participants, I welcome you on the board, both of you. Now it's up to you, like whenever you want to start. You want to a break of 2 minutes, or you want everybody to join. I think about 2:18 have joined, and it's still 2 minutes to 3 o'clock. So
we are live. We are live on YouTube also. Please inform.
Which one?
We are live on YouTube.
Yeah, yes. And recently we are now live on the YouTube too, and I could see many non-faces. Hi Katrina, I know you. You have been joining us with a lot of conferences, and many more faces I know. Thank you so much of the trust you have shown to us for every conferences, and most of that you guys are joining. Many of them have joined from other countries also. I wish best of luck to everyone, and please type your doubts in the chat box so that we can see that. And YouTube has been live, so whoever wants to see on the YouTube also can see. Please increase your switch of the voice for your gadget so that you can actually listen properly, and preferably use the the earphone. That will be even better, because at home convenience, we know sometimes kids, sometimes our family issue. So that's okay. It's good that we have connected across the globe through this conference. Over to you, ma'am. Dr. Prachi Shah, Arora. Welcome everybody, giving the clap, symbolic clap.
No, thank you for welcoming me, and I am glad that My Rehab Academy has invited me to speak on the aquatic therapy over here. This introduction to an aquatic therapy is for everyone. This particular webinar is open for doctors, for physiotherapists, for occupational therapists, so it is open for paramedicals, as well as it is open for athletes, patients as well. So everyone can be aware about aquatic therapy. And since I see it is 3, I wouldn't waste any minute of your time, and I'll start the presentation. And stay connected, because I will be definitely concluding by water shiatsu, and we have Sir Gianni the Stefani over here. And as Dr. Saurav already mentioned, that he is very well known and he has 30 plus years of experience. I would say that water shiatsu, the Watsu technique, had brought a huge difference in my aquatic therapy skills. So we'll be concluding by water shiatsu, and when are the upcoming courses of water shiatsu, which are going to happen in the year 2020, as well as in 2021. We have the schedule with us. Okay, so I'll start with the presentation.
Ma'am, whenever you want to poll things, just let me know. Poll part. Okay.
Yeah. So I would like to understand, let's have the first poll. I would like to understand how many physiotherapists are over here, how many patients are attending this, how many doctors are attending this. So we'll come to know in which direction, because there are even 12 years swimmers also who are attending this particular webinar, to understand how aquatic therapy can be even beneficial to them.
So this is the poll. You can see everyone.
Yeah, the poll has come. Kindly put your
input. Yes.
poll is going on.
Yeah.
Okay.
218 we got, 219 out of 261. Yes. 220.
Okay, so I see here.
Okay. Shall I end the poll?
Yes, please.
Okay.
Yes, I think it's almost done. 95% have voted.
Yes, so
So can I share the result?
Yes, please.
yes, definitely.
Yeah. So this is the result. You can see.
96% has voted.
Physiotherapist only. They are
Yeah,
all physiotherapists.
physiotherapist,
One
and
Nice.
even occupational therapist has
1% occupational
voted.
therapist.
2 people.
Okay.
Two
Fitness
people.
trainer.
Yes.
Today, doctor also is there with us. Three
Three
doctors.
three
Even
doctor.
the patients are there,
Two patients. Yeah.
and other categories professionals also seem to be
Four
interested with us.
four people. Yeah. And second
And
is
sorry,
second.
sir. How about this aquatic therapy in musculoskeletal and sports has got the maximum vote of 57%. And
Okay.
then sport injuries also Suman sir had kept, I mean, differently. So to find out about this clinical part, I think that is also has got about 25%. So combined, if you do that, that goes about more than 75%, almost more than 80%. Sorry, and of course aquatic management. I'm sure some of the professionals are liking that too. And of course telehealth, that is the most important in corona pandemic significance. And of course aqua fitness.
Okay.
Yeah,
So
I'm glad that participants has done it. Thank you so
yes.
much.
So I'll do my best to guide you across with an introduction to an aquatic therapy. I shall share the screen now. You can stop the polling so it can go off.
Yeah. Yeah. It's stopped already, ma'am.
Okay.
Yeah. You can share the screen.
Okay.
Yes. We can see that.
Uh, can this be go on off?
Make it
There's still the poll. Okay.
make it full screen, ma'am.
Okay.
Yeah. Perfect.
And yeah, thank you. So as everyone knows that aquatic therapy can be done outside in an outdoor pool as well as it can be done. Okay. I guess there's, okay. And as well as it can be done inside in the indoor pool. And a therapist can do one-to-one interaction with a patient and as well as with a client inside in the pool when a therapy is to be given. And it can be also be done in a group sessions outside. Either it can be a temperature control pool or it cannot be a temperature control pool, depending on what particular technique are we going to do. So I am practicing water shiatsu. I'm a manual therapist, aquatic therapist, as well as a sports physio for an Indian swimming team. When I go further, do we think that aquatic therapy can be done outside in the seawater? Yes, but it has a different benefits of it and it has a different property that helps. But this is something not an aquatic therapy. And there were questions, are we going to do practical over here? No, it's just an introduction to an aquatic therapy. But even your patients ask you that, will we be submerged inside in the water while doing an aquatic therapy? And if we are going to be inside in the water, will we drown inside? The answer is no. And you're not going to drown. Therapist is definitely going to take care. And aquatic therapy is done with the water level till the chest level, ideally, so that your patient is comfortable and the comfort zone has been achieved when an aquatic therapy is done. When we proceed towards the history, so aquatic therapy, as Dr. Saurav mentioned, that it is new and people are now getting aware about it. But when we see the in history, it's quite ancient. And when I say ancient, Roman culture had it, Roman empires, Egyptian culture had it. Even during the year in 2400 BC, was been going across till the 18th century. And aquatic therapy was not as discovered as an aquatic therapy at that particular time, but people were practicing it. There were hot water springs as well. There were tanks, the small tubs were made. And these tubs came into an origin in the year 1911 when they started telling them as a Hubbard tank. We'll see the picture of a Hubbard tank. Throughout the 1930s, then they started jotting it down, literature started coming, evidences, they started collecting the documentation and practicing. Specifically, it started with the neurological disorders, with spasticity, with cerebral palsy. Then the techniques and the methods started discovering into it. In the year 1937 till 1950s, there were 3 techniques which had came into. Since I saw in the poll, there were more of a physiotherapist, like how in mobilizations, we have different techniques. We have McKenzie, we have Maitland's, we have Mulligan's, we have Kaltenborn, we have Syriac's. Likewise, in aquatic therapy, there are very good 3 major techniques, which are known as Badraga's ring method, Bird and Co method, Helwig therapy. And these techniques are used for treating musculoskeletal, neurological conditions, as well as sports injuries. Lately, in 1980s and 1990s, what is shiatsu, which is known as Watsu. And now people are really looking for doing Watsu. And so that came late back in 1980s. If we see today is like 2020, and half of them don't know what Watsu is. Then the APTA, the American Physical Therapy Association, started as a recognizing the aquatic therapy sessions. And even in a physical therapy, we have these topics to understand hydrotherapy, to understand aquatic therapy. It started in the year 1992. And lastly, in 1993, I Chi was been discovered, which is again to do for your core balance. I am going to show you some images as well as the videos, which will help you guide, as well as some props with me, so which will guide you across how this therapy and techniques go. Still, there are researches and evidences which are going on, and people are coming up with new approaches. This is a Hubbard tank, which was constructed and made out of a mosaic tiles. And the patient was been suspended on this and was taken inside in it. And the therapy was conducted over here. Then the evaluation started, and with the evolution across, there were different forms since mosaic tiles, and the small tiling was into a costlier part as well as difficult to maintain. There were steel tanks which came into an account, and in steel tanks there were ionophorosis which was happening, which is to maintain the chemical balance as well as an electrolyte balance inside in your body. Now we see in some of the clinics there are small hydrotherapy tanks, but now even clinics have started putting up a hydrotherapy tanks which are made of steel. One of it I have in my clinic. I have a stainless steel made hydrotherapy tank in my clinic. And so these small tanks were used for distal joints, like for wrist, for elbow, or for ankle. And they were also temperature controlled along with the jet flow to use assistance as well as resistance while doing the hydrotherapy. We have even fancy bathtubs. And in this fancy bathtubs, the jets are everywhere to give you completely a luxury feeling as well as to do a water massages. So this is how there are evolution happening. Now, this is an image which is describing I was practicing a Badraga's ring method. And with the consent, I have taken consent of each and every patient. So some of the images will be hiding across. Now, when I say over here Badraga's ring method, it is going with a ring, but that ring, you can either, there are different rings which are available in an aquatic stores or market outside, or you can make one with a flexible noodle. So if you can see, I am holding a noodle. It is straight, long. It can be bent across completely, folded across. And this is the one which is there as a yellow. This is known as a connector. So this connector, you can connect the noodle inside and make a circle in this particular way. Even some exercises can be done only with the noodle, or with the noodle and connector, going in a different horizon and then doing the exercises with it. So this is one of a technique which is used for doing neurorehabilitation as well as musculoskeletal. It uses more of a PNF techniques. That's what is shiatsu and Watsu. One image of it. There are many different moves in it. Now Watsu have a specialized floats. So the floats which you can see in my hand, they are of different sizes. Now this is medium size. So it is the second number. There are 4 sizes in it. And this can help in sustaining the person with the help of a buoyancy to help floating so that the leg doesn't go and immerse inside. Noodles can also take your pressure when you have to sit over a noodle and do the exercises. They look quite lightweighted. They are quite lightweighted, but with the help of a buoyancy as a property of the water, we understand, and you can do various other exercises with it. They are doing I Chi over here. Now, when an I Chi is done, the I Chi says that you need to focus with your eyes closed and focus on more of your breathing pattern, as well as there are soft circular rolling movements which go with the hand. And there is a different music again played for it. There are researches which are done for understanding geriatric population, 60 years plus age group population is known as a geriatric population. Now, in this particular population, the balance comes as an issue, like when they age more, or in Parkinson's also we have seen this. So with the help of I Chi, there are different mudras in I Chi which are to be practiced, and it strengthens your core muscles really well as your shoulder muscles. So let's say if I ask you to stand and squat and sustain a half squat position for, let's say, 10 minutes, will you be able to, can you think like 3 minutes? Yes, you can. Squats, repetitions and sets you can, but sustain the position for 10 minutes, which looks like difficult. So every age group, not only the youngsters, even the geriatric population can do it with the help of a water properties. This is one of a technique, a Helvic therapy, which was done by me, and it was support. There are different rules into Helvic therapy, which have the 10 norms, and with the help of those 10 norms, you can help a person to disengage from yourself so that a person is independent and required goals can be achieved. Now, this is a stretching, this is an adductor stretching, which he's doing over here with the help of a noodle. Now, this noodle, because of the buoyancy, is going to help sustaining his leg up, and with the assistance and with the coolant, the water effect, and there are different properties which play on our physiological effects as well as the metabolism, which helps in attaining more range. So now when this more range is achieved, the stretch is really very well achieved. So the flexibility is increased. Now here they are doing an aquatic dumbbell workout. Aqua dumbbell workouts come in different sizes. As you see over here, there is a yellow size, which is a small size, orange, which is a medium, red is heavy. But when I hold this dumbbell in my hand, these are my patents, since you see the name over here. These are my patent, and I have made them. I have done a research onto them for 2 years, and I have all my evidences with me. This was done to understand how different dumbbells are actually soaking water. But these dumbbells, they don't soak water, and they dry easily, and they can be used in any of the pool, whether it's an indoor or an outdoor pool, or whether it's exposed to even sunlight and different chlorines also. So I was doing my research study, and I found that the dumbbells were soaking water, and it was getting error to my study. So I thought to prepare a dumbbell on my own and do the study so I don't get an error. So this dumbbell, when I'm holding, it's really light outside. But when I submerge it inside in the water, it's going to be really difficult for me to push it. Like currently, a pair of this dumbbell is 400 grams outside, but when I take them inside in the water, depending on the depth and depending whether I'm holding it at the surface of the water or I'm pushing it inside, its weight changes from 4 kgs till 8 kgs. Now, this is what I'm practicing as well. We have heard that cupping therapy happens outdoor, but have hardly seen the cupping therapy happening inside. So here I'm holding one of a cup. Lucky enough, before the lockdown, I had these tools with me over here at my home, so I can use and show it to them, show it to you guys. So this cup over here is a silicone rubber cup. Now, when I put across on my hand and I press it, the vacuum is created and the cup can be sustained and the cup is folded up. There are different sizes in these cups as well. And it benefits when it is inside in the water. We are not able to move this cup inside in the water. Very little range can be moved across, but not to a larger extent. But this cup, along with the water property, which is a hydrostatic pressure, it helps in enhancing circulation. Because when I put this cup and I suck it, I press it, it is sucking and pulling my skin as well as my fascia. It has been uplifted, and the tissues which are getting pressed inside are not going to be pressed more. Likewise, I don't have an image to show you over here, but I have a resistance loop over here to show it to you. Now, this resistance loop is an aquatic resistance loop, and this TheraBand VTEL is a TheraBand because Thera is a company, but this is a resistance loop, I would say, and it's an aquatic resistance loop with a different material. So inside in the water, when I have to pull it, I don't get any strain and it can pull to a larger extent again. We all know when we do a high plank, to sustain, it's really difficult if we just suddenly do it. And if we are exercising regularly, it's quite easy. So in a high plank position, done on the land is different. But when you do inside in the water, so I was doing a high plank position inside in the water with an aqua mat. Aqua mat, this is again an Indian aqua mat. It's been designed by me. We have different aqua mats known as boga mats, which are available outdoors. But this wasn't suspended to anything. And to balance on something really unstable is challenging for your core muscles. So why wouldn't a person choose an aqua workout, I would rather say. And we know it's been practicing since ages, but people are hardly aware about it. When it cannot cause any stress on your joints, which are weight bearing, especially if I have to, I'm sustaining this position on the land, will be hardly for a fraction of seconds. But again, inside in the water, will my heel lifted off and I can sustain it for longer without getting any form of an injury or having a fear that I might lose my balance and twist my ankle. So the exercises, which are sometimes difficult to do it on the land, are very well easy inside in the water. And this is only because of the water properties. As well as we get a good resistance inside in the water. Because when we are walking inside in the water, we are actually moving slow comparable to the walk that we do it on the land. I'm sure everyone have definitely done a brisk walk and tried doing a walk inside in the water, in the pool or at the sea or at the ocean around. And when you actually go and walk inside, it restricts you because of the pressure of the water that is known as the hydrostatic pressure. So I go within my next slide. As well as a viscosity. Now, hydrostatic pressure is a pressure which is on your entire body, equally distributed. So on land, if I don't have that hydrostatic pressure, the word itself defines hydro, water, static, the same pressure emitted by the water on a subject which is immersed inside in the water. And viscosity as a property offers the resistance because its density is different now over here. Density will be changing depending on the temperature. Not going to go in the deep because we have all different population over here. So just the superficial, there are many other properties of the water, but some specificity, I wanted to introduce it to you. And if I want to swipe my hand this way, so to swipe a hand, it's really easy on the air. But if I have to swipe my hand inside in the water, it's going to offer me a resistance. Now, inside in the water, in all different axes and planes, it's very much easy to get a resistance. But outside on the land, there are different characteristics, like we have our MMT grading, manual muscle testing grading, which says anti-gravity, which says against the, in the parallel to the gravity, gravitational force has been emitted. So likewise, in the water, we have resistance inside in the water equally distributed. Now, the resistance for an object inside in the water depends on the depth as well. Reduced risk of injury, a cushioning effect. We'll see with an image how useful it is and how beautiful it is when we see pregnant women doing the exercises inside in the water without having any fear. So the property what I'm trying to explain you over here is, if I even plan to fall inside in the water is going to cushion me back. So the property of buoyancy is again over here. Freedom of movement, I explained to you in all the directions we can do in all axes and planes. Slow motion movements, a good muscle control has been achieved. So as I give you an example of walking inside in the water, how resistance also you're getting, you try running harder inside in the water, but it is going to make you slow. So a good muscle control can be achieved. When a good muscle control is achieved, targeted muscles strengthen very well. And aquatic therapy is something which can be used for all age group, right from the pediatrics, right from the Watsu, till the geriatrics, till 60 years plus age group. Unloading of the joints. Yes, definitely it helps in unloading of the weight-bearing joints with the different forces which are going into a negligible. We'll see that image as well of the shear stress. So I have mentioned over here the compressive, distraction, and torsion forces are very much neglected, like negligible over there inside. So here, being physiotherapist, which I saw more in the poll, so I would rather say over here, joint reaction force is definitely there inside in the water, but comparable to land is very much less inside in the water. And with the help of buoyancy, we feel lighter. You'll see with my video how easy it was for me to manage a really heavy patient in my hand, because the body was feeling lighter and I was using buoyancy as a property to do the therapy. With the pressure, improved vascular returns. What does this mean? Patients who are having varicose veins, it's really good for them as well, because your vascular return to the body is going to be much more faster as well as much more efficiently. And this is going to happen because of the physiological effects that takes place on our body when we are submerged inside in the water with different depths. We'll see that image. The last point, I know you are all waiting for an image. The last point, temperature, cooler and warmer. Now, how is this useful? When there are winters outside, or when there is a snowfall outside, or where there is a rain outside, you love to have a good warm shower. And when it's really hot outside, you definitely want to have a cold water shower. So when I say temperature, water, we can maintain a temperature regulation system in that. There are heated pools as well as there are cold pools available. Now, this temperature regulation, how is it going to help us? Warmer the pool it's going to help us in developing a good flexibility to the joints. Muscles are going to be stretched really well. Some of the techniques like Aichi, like water shiatsu is done in a warm pool. Unless and until if I want to have a different benefit, aqua aerobics and aquatic fitness, it can be done in a cold pool as well as in a warm pool. Cold pool has a much more better benefit over here, because I don't have to think across more for my heat stress or heat exhaustion or heat stroke, which we see outside when a person is doing the activity outdoors. So yes, water has its own benefit, and there are many other properties apart from this. So the forces of the bone over here, I was trying to explain. Compression forces are there. There are distraction forces and the torsion forces. So when a good amount of a compression force, like let's say when you are actually stepping or putting your feet on the land quite fast, rapidly you are doing it, there are a lot of compression forces that are happening in your body. There are some activities, there are some dance, there are some movements, some form of an exercises. They are actually going to cause a lot of shear force, a lot of compression force on, and a lot of twisting torsional forces. If I have to do hip hop or a big boing or let's say aggressive Zumba, it's going to have a lot more of strain on my knee. But if that is done, people have taken even Zumba inside in the water. So if a Zumba is done, example, inside in the water, those forces are going to be there, like I said, in the joint reaction forces, but it's going to be a little less. So it's just one example. I'm not saying that, okay, you can do the different things with the Zumba and all, but this is something which you can relate with your patient. Now, when you're relating with your patient, if a patient is having an ankle injury or if getting a rehab with his knee or whether it is an AVN of the hip, so when the forces outside on the land are really going to be hard enough and person is just gaining weight because he can't go for a walk, it's very good to take a person inside in the water and do her rehabilitation so that these forces are quite negligible. Over here, I'm giving as an example of a buoyancy. Now in the buoyancy, a person is having example as a 200 pound. He's weighing 200 pound. But when the water level is till the hip level, till your pelvis level, it is going to be 50% only the weight that he is going to feel on his knees or ankle or the weight bearing joints. Over said the pelvis. Now, when a person, same person enters into more depth, till let's say a zippy sternum or till the chest level, it is going to be 30%. So a person is going to feel only 60 pounds weight. But when a person is going till the neck level immersion, the gravitational forces are going down and the buoyancy is going to act more, which is going to have only 10% of the body weight and we see only 20 pounds. So when doctors also prescribe that partial weight bearing exercises to be started and non-weight bearing exercises or full weight bearing exercises, depending, even you can choose your aquatic therapy program. We see it's very easy to do the stretching inside in the water and to attain a good range. But with the good range, even you can maintain this position as well. It's not going to cause that much stress on your body. Likewise, we see over here, they are on their tiptoes and they are pregnant, but they are not having any fear that they might fall or injure a baby because of the cushioning effect again over here. This is, they are doing I Chi, and in I Chi, one leg is raised up, the image which I showed previously, and it's very easy to maintain the position for a long. So balance, coordination, stretching, flexibility, everything can improve with it. So I would rather say in the benefits, on land, your joint may be too stiff and painful to move, but with the water and its different properties, it's really easy to move inside and to reduce the stiffness, make your joints more flexible. There are different properties of water, but four major things that we found only in water and not on land differently is the buoyancy. Till now, I have talked about buoyancy. So buoyancy is definitely which we found inside in the water. Hydrostatic pressure, mentioned to you about it. Resistance, which we get inside in the water in all the direction. Temperature. So benefits are multiple, and why not a person choose it? Now, when we tell about or speak about core muscles, so everyone says that core are a body pillar and you need to strengthen them. If you strengthen your core muscles really very well, you are not going to have any injuries, or you are not going to strain your shoulder or your elbow or your ankle. Your core has to be strong. Earlier, core was been mentioned as only 4 group of muscles: abdominals, back, glutes muscle, pelvic floor also included, as well as your diaphragm. But when the researches and studies across are done, to maintain a pelvis in the stable position where your core muscles are acting, it doesn't only count only at the abdominals or at the back muscles or the glutes. It also includes your hip joint muscles, which are two joint muscles. It also includes the higher upper back as well as the mid back muscles. So core is not only to strengthen your abdominals or back, but also to be focused on the muscles entire to your torso as well as your hip joint. And we know that there are no risk of injury. It's very good to relieve pain in osteoarthritis, inflammation, to attain the range very easily without having any stress or shearing forces on the joints. And when a person enters inside in the water to do the exercises, he can do more exercises and without having any pain. So he or she feels to do more, which can help in increasing the lean body mass, the muscle mass, as well as the bone density. And inside, have you ever tried getting inside in the water and trying to balance yourself inside? The moment you enter inside in the water, your core muscles are activated. And in a less time, when you can get entire benefit and conditioning of your body, why wouldn't you try? Because it doesn't require any specific swimming skills. If a person says, I'm a non-swimmer and I don't know whether I can go for an aquatic therapy or not, trust your aquatic therapist. They will make sure that they will attend those ranges and make you comfortable by teaching you the different techniques, and no specific swimming skills are required for it. Hence, exercising in water, I would say, is always fun for me. And to see the other exercise. And we see the faces of individual over here. They are really happy to do the exercises inside in the water because it is not making them too tired. They are taking precautions very well as therapist is also helping them to stretch to maximal. Therapist is also, there are babies also which we take inside in the water for a rehab, and to make sure they are able to attain their daily activities very well. So these are some images. Even we can do the rehab inside with an aquatic treadmill, which is, I'll describe it later in the slides. So yes, after an injury or surgery, sensitivity increases. Pain a person feels while doing, because there are a lot of healing processes going inside. There is an inflammation going inside at the part. The tissue was been damaged, and to bear a weight is really difficult. But water supports every of this thing. Hence, to take a patient inside to improve its mobility, strength, and function during the healing process is very good. And they don't have to do a bed rest. So you can ask, you can discuss with your doctors. A therapist can always check. So aquatic therapist also can always check with a physiotherapist, or in physiotherapist and aquatic therapist, both can also check with the orthopedic surgeons as well, or with the neurosurgeons, and understand a person's terminologies and contraindications and indications, and take a patient inside to do the rehab. Is knowing swimming required? Really no. And we see their faces, they are really enjoying doing the aquatic fitness I was doing with them. In India, dance is everywhere in all different forms across. And there are bhangra, there are dandiya, there are garba. Everyone wants to dance. But when you have knee joint, when you have heel pain, when you have calcaneal spur, when you have a vascular necrosis, when there is a low back pain, and you really don't want that much amount of a pressure on your joints, what can you do at that particular time? So they are doing even an aquatic dandiya inside in the water, and they are happy that they are not having any pain or not having any stress on their joints while doing it. So while concluding the benefits of an aquatic therapy, I would say it is helping in toning your blood vessels, functioning. All body metabolism and all organs are going to its different physiological effect, which is ultimately helping the body to achieve, and as we say, throwing off the metabolites and waste materials out of your body so that body can function well, enhances everything and strengthens everything. But the good thing is it happens at one go, at one time, in less amount of time. So there are multiple benefits in an aquatic therapy. And since we see multiple benefits in an aquatic therapy, all different fields can use it up. There are neurological fields, psychology fields, health and fitness, women's health, geriatrics. We can use in all different possibilities and all different variable conditions with it. Question is, can I do an aquatic therapy? After understanding the benefits, vast majority of people can definitely do, but certain medical conditions are contraindicated, and certain medical conditions are as well as you have to take precautions. They are not absolutely contraindicated, relatively contraindicated. And treatment, rehabilitation for your neuromusculoskeletal different conditions, pre-surgery, post-surgery. So post-surgery, when I say over here, even with a surgical tape, which is waterproof, surgeons do permit that, yes, you can carry out the aquatic therapy with them. And they are not wasting their time or their day by getting the progression well. So the prognosis is really faster, quicker, and better. As well as in the cancer rehabilitation, maintaining obesity, diabetes, thyroid, to maintain the hormonal levels, it does help. And there are researches which are also going, which are done as well as going on for this. Some of the contraindications and precautions that a person needs to understand. It's not like you have learned a particular technique or you know a particular technique or you have been educated about a particular technique. Can this be done? Make sure team rehabilitation is done. Ask a physician what are the problems, understand a patient's problem, go and check with a radiologist, convey the message or ask their orthopedic or neurosurgeons or their coaches or trainers, and a holistic approach can be done, and we can understand whether they are really contraindicated or they can go further. I had done my research paper, and in the year 2013-14, Indian swimming team and Swimming Federation of India was really helpful to me to do this study on the swimmers. They have a swimmer shoulder condition, and Dr. Shyamul Kole, sir, he was my guide and he explained me throughout the process as well. And my paper presentation, I can just connect you to the link. So this is a paper presentation which was done and which explains that yes, by doing the aquatic therapy, it was really helpful to understand the Barks grade, and the SPEDI scoring system was also done. I have an entire article which you can see on a human journal. So this is another image of seeing how the core strengthening can happen. We can do the exercises by keeping the foot on the floor. Even we can suspend ourselves off the floor to make you understand how easy it is if you try to balance with the parallel bars and try to lift yourself up and maintain this 90-90 position. It will be difficult initially, but when you try to do it inside in the water with the help of noodles or with the help of a dumbbell, aquatic, it is very much. And you can see some convolutions happening over here. So that's how the muscle is as well as working. Now these are aqua fans, which I'm using. So if you see in my hand, this is an aqua fan and it comes in a pair. So the concave is there as well as a convex side is there. Now this concave is going to have a lot of tension when I have to push or give me a lot of resistance comparable to the convex. How I can give you this as an example? Likewise, let's take a shark fish, okay, or any fish that in that sense. Convex body helps in cutting the water currents easily, unlikely the concave. And if I give you as an example of concave, in swimmers, when they have to do, we all know that butterfly stroke is really hard. So when a butterfly stroke is done, the body is making a concave and the surface tension is going to increase with it. And that's why the resistance is also going to increase. And that's the reason why butterfly stroke in the swimmers is tough comparable to it. So this concave convex devices will add me an additional resistance. Let me make you understand that any of the aquatic equipments are going to add on the resistance and also going to help assisting the movements which you want to do. Likewise, I wanted to suspend myself and do the contraction as well as do the muscle strengthening over here. So this particular exercise, suspending, I can never imagine myself going on one hand and both the feet off the floor. Okay, one foot off the floor, we all do in the side plank position, but both the feet off the floor and having a good contractions is really difficult on land. So there are different approaches in aquatic therapy, and we have various different approaches in aquatic therapy. There are aquatic fitness, yoga, water relaxation, massages, aquatic treadmill, and more researches are happening and more approaches are coming across. Like we now see there is a water cupping also which is there, which can be done. There are aqua swimming, spinning, as well as an aquatic trampoline. We'll see an image of it. Yep, there it is. Aqua trampoline is you are definitely jumping inside in the water, and it is going to give you very light resistance and the buoyancy is going to help you across. Here, you don't have a fear of straining yourself, but there are different aquatic fitness programs also which are happening with the pole and a boxing kit across. So you can strengthen the muscles as well as you can hang on to the pole and do the various workout. We see an aquatic treadmill. So you can definitely do your walking, running inside in the water. But if you want a really good speed to do it across, and you don't have a swimming pool, there are the aquatic small tanks, treadmill tanks, which are been made, and you can do it likewise. In India, this is my clinic's image. In India, we had did a first aquatic underwater treadmill. Generally, there are the treadmill which have water can be drained and the motor is outside. But this was first Indian underwater treadmill which was made in India, and we had tried as an example in our clinic, and it is working very well. So yes, in India also we have a small tanks, and Aquagym is the one who is selling them across for an underwater treadmill. How do we saw all the benefits, we saw some properties as well. How do we take our aquatic assessment? And everyone has a different assessment and a consent form for it. I take my aquatic assessment depending on what particular result I want, or what is a person coming to you for what goals he wants to achieve. Let's say it's a sports person. So I have a different aquatic assessment form for a sports. If it's a fitness, aquatic fitness assessment form is different. If it is musculoskeletal, aquatic musculoskeletal form will be different. Or let's say neurology, it will be different. Accordingly, how we have in our physiotherapy a different assessment forms, and the way we take our assessment differently. Likewise, even in aquatics we have. But to focus on the individual muscles and conditioning, muscle strength as well as their endurance is important. Now, when I say muscle endurance, so let me give as an example over here. If I have to lift a 15 kilo box, let's say 10 times or 100 times, that is going to detect my muscle endurance. But if I'm lifting a 50 kilo box or a 100 kilo box only for one to check how much is my strength, that is my muscle strength. So muscle strength to train muscle endurance, to train and to even condition your vitals is really important, because you are working on a human body, and an entire body conditioning and strengthening has to be done, because there are various zones. So like, I don't believe in holding a plank for a certain seconds or minutes, because you are not going to be static for anyone. Are you? Like, I'm not going to be a dining table for anyone. My core muscles require to be challenged in all different position and axis, because I am going to do my work in my daily life or in my professional life in dynamic movements, and hence my core muscles require to be engaged and challenged in multiple planes and axes. But we should not forget that we are not an amphibians, like we are not an amphibians. So we need to do our transition and progression with even land therapy. We don't only have to be only doing aquatic therapy. A transition has to be, after all, we are going to live on the land and gravity forces are going to work on us. So yes, the transition therapy also has to be done, and then maintenance and fitness. So these are 6 phases on which I do my rehabilitation in aquatics. And as we see over here, I have put ankle weights. There are aqua shoes, which I'm wearing, and noodles. And I am doing the exercises in neutral position, in long sitting, in a flexion position, in the side lying. So all different axes and planes, as well as in a prone position, standing and pushing the noodle down. I'll show you some videos of the same. Or balancing, let's say, myself on the noodle. So when I have to balance the core muscles, when I have to push it down, my core muscles have to work. And core, not only mean abdominal, my leg muscles also have to work onto it. All doing cycling. I had given an article in the Physio Times in the year 2017, where I had explained about how sports injuries rehabilitation can be done in an aquatic approach. And I'm glad now various other fields, and I see when I started back in 2012 and now 2010 and 2012, and now I see there are a lot many clinics which are having pool and want to invest in the pool to make sure that the rehab is done well. You don't require always to have an indoor pool. It can also be done in an outdoor pool. Aqua gym can be done inside, and so I have a resistance band, a TRX, a pole in my pool, and kettlebell were being used. And to do this exercises inside was really easy. You see some images again in the outdoor pool. It is not going to put any load on your shoulder, and to lift it is really very easy. Now, when I say over here the weights, the actual weights, now if you see in my hands, there are 1 kg, 1 kg, they are the PVC dumbbells. They can be used as well as inside in the water and outside on the land also. I have got them from Decathlon. Now, when I'm using them inside in the water, it's very much easy. I don't feel 1 kg as a weight. Try that out someday. I mean, definitely when the lockdown opens, you all are waiting for it. You can try that out and you really feel it very easy to do the exercises inside with 1 kg. Likewise, if you take 5 kgs, it is going to be again easy. You're not going to feel that much tension. So density is over here changing. Now the ones which are actually light become heavy, and the ones which are heavy actually become light inside in the water. There are different equipments which are again going to add only resistance to your body and make sure the strengthening is done well. Your therapists, so some of them must be thinking, well, we are seeing a lot of off-leg exercise, off-floor exercises. And here the legs are balancing on the floor, but there are kickboards which are placed underneath their feet and they are balancing with their eyes closed and focusing. I understand when we say physiotherapy, we don't have to see exercises. We can understand from exercises, but we can make our own exercises. And that's what physiotherapy is all about. We can make our own exercises by understanding the biomechanics, which is the heart of a physiotherapist. And the joint reaction forces, the ground reaction forces, understanding very nicely their anatomy and how much strain. We can merge everything of this with axes and planes and see what muscles are we working across. So unless and until you don't do exercise on yourself, it's difficult to make sure that your patient is going to do the right one. So always I would guide and ask that you experience it on yourself, and it will be easy to guide with the other people, and you might come with new exercises. So where does aquatic therapy occur? The question is, it can occur in an outdoor pool as well as it can occur in an indoor pool. There's an image over here which I'm doing a water shiatsu. I'm doing cupping therapy. I've asked a person to sit in a comfortable position so I can do the cupping for her metatarsals. And no need to worry. There are some pools and there are different techniques your aquatic therapist can guide you with. If you don't have to walk down the ladders inside in the pool, there are lifts, there are chairs, there are movable equipments where they can get you inside, or there are different techniques where you sit at the edge of the pool and they can take you inside. And so you need to learn all these techniques, and but there are even equipments for them. A group session which was been done in an outdoor pool, and they don't want to lose their balance. Some are swimmers, some are non-swimmers, some have water phobia. So they are holding their hands and doing their stretches across. In a deep water, you can suspend yourself with the help of a dumbbell, as well as doing the strengthening with the gladiators as well, and a water belt. The motor generated treadmills are there, where you can change the speed, or there are the rollers, even where you can practice your incline. So I would rather say, is there a special equipment to use in an aquatic therapy? No, you don't require specific tool initially, because water itself is giving you the resistance, and you can do a very well. And let your patients, let your clients, everyone should feel how water is helping them. How are they feeling? Are they comfortable with it or no? Then only introduce any equipment. So you can definitely take various exercises with it. And then once they are comfortable, you can put down with the other equipments. See, everywhere we see the water is till the chest level. They are not going to drown inside. It is very much comfortable to do the exercises. Even when they have closed their eyes, they can stretch to the limit, and they don't have to worry that they are going to fall inside. Different equipments. Here we see the spinner is not there, but only the pedals are there. Here the spinning system is there, where the gear systems are also there. Now this additional fins are going to increase just the resistance. Likewise, I said, the more the area, it's going to give more the resistance. So like I made with a noodle and a connector in the other way. There are cervical collars, there are ankle weights which can be used, fins, aqua dumbbells, many more. And you don't have to purchase unless and until you want to do the exercises on your own. And there are various equipments. There are different flotation devices where your therapist can guide you across. Aquamat can be used with the kids interaction, or when they are not comfortable always, and he is just 6 months. And even that can be used for a therapy where you want him to balance, or you can put the noodles underneath and he can balance as well. So aquatic treadmill. Now this waterfall, is it for it? It looks really good, but yes, they are enjoying a jacuzzi behind over here and a waterfall which is there ahead in front. But this can also be used as a water massages, as a jet massages, and to massage your back. And most basically, I have put this across to even make sure that the drainage of a lymphatic fluid can happen. So I take my cancer patients as well as over here. And when they have undergone a mastectomy, this is really helpful in the technique. Let's see some videos so that you can really understand how are we going across. I'm going to click each one and we see that up. So this is a reverse treadmill that is going, and treadmill can be done forward as well as in a reverse position. We can change the speed of the treadmill also. And he is doing his ankle mobility. We are going to do again a forward treadmill. So he is resting it up over there. I'm asking him to leave his hands and then start running. And we are seeing as a forward treadmill. Now he's doing. We'll see the other link. Now over here, likewise I said, I am suspending a person, and it's very easy for me to do the exercise and holding and do water shiatsu with him because I'm using as a property. I have off the lights and I have on the different lights inside in the pool. His eyes are closed. Here the person is doing the sideways. I have asked the person, she's having ankle weights. She has undergone an arthroscopy, so knee ACL reconstruction surgery. You can find as well as all these videos on my YouTube channel, Prachi Shah Arora, and you can find them up over there to see how the rehabilitation had taken place. So treadmill, yes, they are useful, and you can also make the same exercises. You can do it inside in the water, even if you don't have a treadmill. Now she is running quite fast. If we see over here, since you have already seen the treadmill, I'll go to the other video. So I'll play from the beginning again. So I am taking my legs up, suspending, not touching the floor, taking my legs back, and again contracting my abdominal muscles and stability with the hands and taking them. So I'm working on my back extensors, my glutes, my abdominals. At the same time, I'm not feeling tired at all. This? Yeah, this is where I'm doing aquatic cupping therapy inside. You can choose either if you want to go inside and stay inside for a long period of time. That's the reason I was using snorkel to see as well. Well, I'm doing aquatic cupping there inside. She is an osteoarthritis patient as well as having a medial joint. So even a lot of mobilization techniques can be done inside in the water. And always make sure you document each and everything, what you do and how are the results. The log entries are really important to even guide you as well as how to guide across with the different techniques. I'm asking her now, bend and check, do you feel any pain with it? She's wearing an aqua socks. And it was absolutely good while she was doing that. And the range was also more when she did that. Now, some videos I have put it on the Insta. And as we see over here, he is post rehab fracture. So we see the site over here and I am asking him to squat and run. Now she is she is 72 years old and she is using the aqua fans and she is doing an exercise with an aqua fan. She is doing the strengthening exercise. She is maintaining the squat position till she completes the 30 repetitions of it. I have changed the light system inside. Sometimes I use white light, sometimes I use yellow lights, depends. So concave were facing and they were giving her resistance. So I was working on her pectorals and as she was gripping the fans, it was also working on her hand intrinsics, interossei. Now, he is, I guess, Paralympics. Yeah, Paralympic sports, paraplegia. And we were training again with him. I was asking him to maintain a squat position and do it. One side is convex facing him. One side, if you see, is concave facing him, as well as the weights. So these are 1 kg weights, aquatic weights. These are again 1 kg weights. Unfortunately, I have lost some videos, but it was good that they were there on the social side, so I could connect it with the link and I can show it to you. On an aqua mat, trying to balance and do Pilates. So holding the position as well as this imbalance. I am understanding the timing, just we will end up in next 10 minutes. And let's see this dumbbell and she is doing the exercise over here, ankle weights, maintaining the position as well as working on her arms. We have one last video. Okay, so she is 4th day post-op, which was done. She is walking with her eyes closed, day 4 aquatic session. TKR, her surgeon had allowed me that yes, the dressing is a waterproof and you can take her inside in the water to do an aquatic therapy. So yes, this was some of the videos. And before we ended up, just there are few more videos which I have kept over here. You can pick them up so that you can see them well. Good. So he is doing the exercise inside. As we see how his abdominals are working, he's not having any stress. So the kids who want to definitely go to gym to do the exercises, but the body weight training, some parents don't allow them. The exercises can be done very well inside in the water and we can get a good strengthening. And we can also make sure that we can help in preventing obesity. Now, the cycling, the way he is doing, even you can try with a noodle and his feet are not touching down. He is cycling continuously by holding one noodle ahead and sitting on one noodle there. He is 10 years old and it was good. He allowed me, he said, okay, you can show my videos, that's all fine. So he is now working over here. And as we see the contractions happening, he's also pulling, so he's working with his shoulder flexors as well. Fans and the noodles. So I was using the concave, I was moving ahead, doing cycling, as well as doing the fans, pulling and dragging it towards me. We have a marathoner video here. He is also training himself and we are running at a speed of 12 km/h inside. So the treadmill also tells and how much calories a person is burning. We can see his front view, whether his angles, whether his gait pattern going right or wrong, his foot alignment, and at the side, how is he doing. I'm also thankful to a very well-known Indian marathoner, long distance runner, We have many more things. He's a Rajvadagma, sir. Even when you suspend and you have to balance on. So the noodle, he's balancing, he wants to do it fast. But as I explained to you in one of the property ahead, that the slow movements can take place, but his muscles were working there and he's actually enjoying very much to do that exercise. We have aquathons, which are every year, and aqua awareness is spreading through them. There are a huge amount of people who participate in aquathon, which goes for 3 hours. So you can even do the exercises without having equipment, because water is giving you a resistance. And then for them, there were aqua dance, which was there. Some games were there and medals to give them. So it's a feedback for them. Yep. Yes, and when everything is done, a person wants to relax inside. And how can water not be the very good medium to feel relaxation? When even when you walk in and just water touches your feet, you feel so relaxed. You can either suspend or you can take the wall support. So they are doing the relaxation either with noodles or with dumbbells. Different games can be played with the kids. But after all of this, is it normal to feel this post-aquatic therapy, that what your patient or your client messages or calls you and asks you, I'm feeling really thirsty today? Yes, you will be feeling thirsty because you have lost a lot of electrolytes from your body. And when you lost a lot of electrolytes from your body because you have worked out a lot, which you have not realized, being water around you, and you have not got any pain or strain. And even if you sweat, you are in the neck level water. It's the water surrounded you, you don't feel thirsty. But later when you come out, yes, you do feel thirsty. So make sure that you hydrate yourself very well when you're inside in the water, to avoid any headaches or any pains or any soreness that may come. And yes, when you feel hungry, make sure your diet is really well, and not just when you get out of the pool to see samosas or a junk food across or have vada paos. So it's going to mess up with your system. We do feel very good flexibility, and the same day we get a good sleep. Some people feel really fresh after that, and so mostly the sessions are being taken in the daytime and are been avoided at the night time. They ask whether am I safe? Trust your aquatic therapist, trust your physiotherapist, trust your doctor. They have guided very well across and they know the norms. They have checked across. Your aquatic therapist have taken care of the hygiene of the pool and have spoke to the manager across to see whether your restrooms are fine, the pool floors are fine, there are rubbery mats everywhere, there are anti-slippery mats everywhere. Your therapist is CPCR certified, cardio, pulmonary, cerebral, resuscitation. CPR was updated to CPCR because it was definitely brain plays a major role, your cerebrum plays a major role. And if a person is dead with his brains, he's actually a dead body there. So consent of your clients and your numbers, everything has been taken care, log entry details. Each day the evaluation is done. Instructions are given. And after taking your assessment, they know that what is the comfort zone, and they are maintaining the confidentiality and the safety of themselves, patient, as well as the pool. So always when there are things, you need to ask your aquatic therapist. But what you need to remember is, you need to remember that you hydrate well. You need to remember that you are using a perfect outfit to go inside in the pool. And it's not going to come as a restriction or a barrier to do any particular exercises. Follow the instructions given to you. Follow the instructions given to you by your therapist. And the instructions which are mentioned on each and every pool or an hydrotherapy tank outside. Do not use oil, or do not put oil onto you when you enter in the pool, because oil is just going to float over there. If you really want to use something, I'm trying aqua lotion, and in my workshops and in my therapies also I tell that you can try an aqua lotion if you want to really put on you. And mulin eardrops are something which are advisable before you enter in the pool, 20 minutes before, so that you won't have any ear infections and the water is not going to clog if you dry after coming out from the pool with the swim eardrops. Make sure you convey your messages, your discomfort, or your queries to your aquatic therapist, and they'll make sure that you are comfortable. Shower, not only before getting inside in the pool, but even when you come out of the pool. And drying yourself is really important to avoid any kind of an infection happening. The most important thing is enjoy your aquatic therapy. And it's really fun. We have events like Aquathon, which come in November every year. And we have Watsu Week, which happens in the month of March to spread the awareness. And everyone participates for it. We are spreading the awareness together. So I'm going to conclude my slide over here. And I would say rather, it's not only swimming in the pool. It's much more than we know about it. Not only even doing aqua aerobics or aquatic fitness, different therapies. And what I have found useful with me is Watsu. And hence I wanted to share this with everyone so that each of us can be aware. Even I can use Watsu therapy in my techniques, in my aquatic therapy as well. We actually fuse, right? We don't only use one particular mobilization with our patient. Let's say I'm only going for a McKenzie mobilization. I wouldn't say that. What is convenient for my patient? How I'm getting to get his goals achieved faster? How my patient can be discharged sooner? I'm going to work on that. So I'll be approaching a holistic approach. And trust me, when I am giving a session and when I'm receiving a session, the session I'm talking about is Water Shiatsu Watsu, is an ultimate a different experience. And I wanted everyone to be aware about that. So it's really a privilege to have Gianni sir with us. His full name is Gianni Stefani, as we see here, and he is a founder of Watsu India TM, Institute for Aquatic Bodywork in India. And his aim is to spread this beautiful bodywork across in India and all over the world. He has been traveling worldwide since more than 30 years as an organizer, Baba facilitator. He is facilitating Watsu Basic, different Watsu courses, meditation, yoga, Watsu for babies, pregnant women, and he is discovering the other techniques as well. It's a privilege to have him over here for his discussion. And when we see his credentials, he's a Swiss swimming aquatic fitness instructor. He's a sports teacher instructor. He has done his studies in physiotherapy. He's a swim teacher for babies. He has a trainer. This all are certifications which are done by him. Oceanic Bodywork Aqua. He is trainer for Watsu Basic, different levels of the Watsu. Some of them had misconceptions about Watsu, that it goes for so many years and everything. I'm glad that, and I am definitely sure that sir is going to share his knowledge with you on the same. Trainer anatomy, certified aquatic body worker. He's a yoga trainer and he is even into Tansu and Ayurvedic mama massage. He is doing his Swiss, he did his Swiss Olympic certification for adult pedagogical teacher as an aquatic sports professor. So over to you, sir. And I'll pause my share. Then I'll discuss across when are his courses coming across, and I'll then, yeah.
Thank you for welcoming me. I'm happy to join this webinar meeting, first time for me. I'm a little bit older than all of you. I was starting in Arora 33 years ago, teaching aqua yoga and water shiatsu, and still we are on the stage. Next year we have a program that you can then have a look on it. In any case, I would support what Dr. Prachi was saying. Aquatic therapy, any kind of aquatic therapy is an amazing tool that can improve recover up to 3 times. That means if you have a good protocol, between water activity and land activity, you can really give a huge advantage to your patient. About Watsu, Watsu is the last developed tool that we have in the aquatic therapy. It exists now since more than 40 years. And yeah, by Watsu we can say that it's a perfect tool to free the body in the water. It can bring you to a deep relaxation and to release all the tension in the body. What we have to understand about Watsu, that is a passive technique that is working essentially on symptom. It will not directly heal causes, but it's a tool that you can integrate in a protocol for every kind of rehabilitation. In the American Therapist Association, Watsu is Aquatic Therapist Association. Watsu is one of the tools that they learn in the school. And I'm available for every kind of question if you want to ask.
Yeah, Prachi ma'am.
Yes, sir. So we are seeing some questions over here with
Saurabhji will guide all these things.
Yeah.
Yes. So before we ask anyone about the questions and everything, I'll just share this screen again.
Okay.
I'm going to share the screen to understand. So yes, sir very well mentioned about Watsu, and these are his upcoming courses, which are going to happen in 2020 in India and 2021 in India, which you can note it down. And if you miss anything, you can also check on Quiet Healing Center website, and you will get to know his dates and every details about it. And questions, I guess, with this will definitely help you up, that the details about the aquatic therapy further and how we go across and how to manage the pool and how much does it cost, where does this take place and what to do for an aquatic therapist, everything will be answered and will be solved across in the further webinars which we are going to have it. So, and even if we are not able, with the time limit, we will be discussing some of the questions definitely. But if I'm not able to discuss the other questions, you can definitely connect me over here. And I'm thankful to my Rehab Academy that they allowed me to share my details, so where you can ask me and approach me other questions when you have any. Thank you very much, everyone. And yes, I will stop the share.
Yeah, over. Sorry.
Yeah. Ma'am, you'll be taking questions?
Yes. Yeah.
Yeah. The question what you had seen, the first of all, like PCOD, right?
Correct. I guess Janet has asked about it. And
yeah.
Yes. So when she is asking about, have I seen any PCOD cases inside in an aquatic therapy or have helped across or no? Yes, I have seen PCOD cases, and along with, I have my research articles also about the same. I have seen PCOS and PCOD both, and with the 12-year-old till the age of 32-year-old. And in them, I have done 12 weeks of study where alternate days I was calling them and I was taking 45 minutes of the aquatic fitness exercises with them, and have seen that even after completing their exercises, now let's say how old is she? One of was my friend herself, and she is now 36, and she is like, it's been 6 years and this has not again occurred well. So along with medications, yes, the exercises both are going to benefit, but she was taking in homeopathic medicine. Hope I have
Next is about range of motion.
Okay. Yeah. So will the improved range of motion remain after the session when we perform the same on land? Yes, it does. The range what you have improved, it does remain the same. But as I mentioned, the transition has to be done. So when you have achieved a good range inside in the water, make sure that on land, you take the next day the session and you also work on that range. So that wise, likewise, the person is not going to have always the pain, or while attaining the range, you are not only going to create an inflammation. Also try different mobilization techniques so that they don't actually have a pain and the ranges can be achieved and it can be maintained. So give them a home exercise program as well.
Thank you so much. Next question is about aquatic rehabilitation principles. Some principles about aquatic rehabilitation.
Okay, so what is the question about principle? Can you please explain? Okay, I got it. Aquatic rehab principles. He lost the connection and the net issues. There are a lot of aquatic rehab principles which you need to take care about. And so the first principle is you need to understand the water properties really very well. Second principle is you need to understand what are the contraindications, what are the indications. Third thing, do your assessment thoroughly. Listen to the history very well, because 50% of the case is solved when you listen to the history very well, which will guide you to the diagnosis. Related with an aquatic therapy, you can select then accordingly whether you want to take a person for which particular technique, since there are various number of the techniques. And knowing the person's comfort zone, whether he's a swimmer, non-swimmer, he has a phobia, he doesn't have a phobia, can he enter in the pool on his own or cannot he enter in the pool on his own? Okay, and now let's say as an example of osteoarthritis, since many more cases are osteoarthritis and even doctors are now recommending go for an aquatic therapy in osteoarthritis. So after an assessment evaluation, I'm going to now take a patient inside in the water. Just I will ask the person to feel how the water is giving them the resistance. Then I might use an aquatic cupping technique with him, or I might give an aquatic mobilization to him. Depending now, I'll choose my phases. I want to strengthen, I want to condition. So I am doing my aquatic principle on different phases. 6 phases are there, where I transition my patient as well and make sure that the patient is able to do them on land as
Okay,
well.
somebody has asked twice about spastic hands. Like what do we do about spastic hand if it is?
Role of aquatic therapy for spastic hands, there are like you can manage by they will be having completely going into a pattern. Now to break this particular pattern, you need to know your PNF well, whether you're going to use a D1 technique, you're going to use a D2 technique. But it's always better to take this particular person in a lukewarm pool or in a temperature regulated pool so that the spasticity doesn't increase. And then you can suspend them with an aquatic noodle or with the floats around them and making sure that they reach out. Like even you can use a Bobart technique inside in the water. But for this, you need to really know when to do the spasticity. We can go more details with the Hellevik therapy.
Okay, how about the lighting, the kind of lighting part of the pool? Do we have any special color to be used, like something like that?
Okay, so to relate it with the lighting, it was on me. I wanted to use white lights. I wanted to use yellow light. It was a stainless steel tank. I wanted to paint a color onto it to just make it look good with blue color or with yellow color.
Okay.
It depends on everyone. You can also keep it plain how it is.
Okay, so there is a very intelligent.
Just a minute. Like I believe in light therapy. That was the reason, because the light around you actually makes help to do that particular therapy also continue very well.
Okay, can you summarize some of the criteria that you choose the patient for aquatherapy? I mean, somebody has asked, like in general.
Okay. So
few criteria, like how do you indicate that yes, we can do it?
Okay. So I first see with I check out for the contraindications. Very first thing, that the person is not having open wounds, or which even if a person is having open wounds, are they having a surgical tape which is waterproof or no? I discuss with their orthopedic surgeons that I feel I want to take this person in an aquatic therapy because it can have this many benefits to him. And since we have a limited period of time, this particular person can actually be able to go inside in the water, do the exercises by themselves, or even I can guide. since a person is having even a swimming pool in his society, let's say, so it's better that I make him understand the techniques, or to at least make sure that these exercises are done, and those exercises he can take care in his pool over there. Other criteria what I look forward in this is that a person's strength, how much is it available? Can I achieve it faster or no? How much endurance is available? What is his blood pressure? How, and what basis I'm assessing? Is a person going to enjoy the water work or no? Can a person float easily or no? Or do I need an assistance or other equipment to make him float very well? Is he on any medication pills? Like, is he on sleeping pills? Or is my taking inside in the water going to cause him more, he can sleep in between of a therapy? Is that going to happen or no? Depending on various measurements and assessments, I'll take a patient inside.
Okay, I would like to take any more question, ma'am, because
yeah, we can actually, they can all email up to me. The questions for Gianni sir related with Watsu, they can go ahead with it.
Related to Gianni, sir?
Yes.
I think no one has indicated for sir. Is there anybody you can raise your hand and ask directly? For sir, I think there was no, like, but there was one question about pediatric physiotherapists. Like, what is the scope of aquatherapy? We can go ahead with that.
A huge scope, because as we see that, so comparable to the earlier stages, when like in 1911, when I said the spasticity and the cerebral palsy, they had started. We are in 2020, like in 21st century. And what are we up to? We are doing now aquatic therapy. Awareness is spreading very well across the globe. The thing is, in pediatric physiotherapy, aquatic therapy is going to play a major role. There are waterproof diapers which are available. There are other things that you can take care with the different chemicals that you can put inside in the water, which are not going to harm the baby or not going to harm the pediatrics. But a lot many places, pediatric and neurophysio aquatic therapy are being taken place. It's aquatic sports and aquatic musculoskeletal, which people are not aware about. But aquatic pediatric physiotherapy is already, which has been practiced quite on a huge scale, comparable to aqua and sports and MSK. And hence my awareness for today was aquatic sports and aqua MSK.
Okay, one question came many a times. I think about 10 people asked, what about hydrophobia? If someone has hydrophobia, like how do we go ahead? Should we go ahead?
I may answer. I see there are a lot of questions about hydrophobia. No? Hydrophobia, 99% by every person can be released with a simple, easy protocol. No, but of course, we need as therapists to know how to do. And it's not so difficult, but in 2 weeks you can overwhelm the most of the hydrophobia that patient may have. One of the conditions is that the patient has to work a little bit at home. I have specific protocol for that. And one other question that rise up is about aquatic therapy after surgery.
Then what is the alternative?
If it's possible to go in the water the day after a surgery, for example, a shoulder surgery or a hip surgery, to make a sample, then you will really have a big advantage on the rehabilitation time, and also on the quality of the rehabilitation, because that will avoid a lot of post-surgery problems. Yeah, and at the end, about spastic people and all kind of also other disease, using Watsu and other aquatic therapy, it's obvious that can help to increase the recover process. Only if you think a very simple thing, no? Our body, our muscular skeleton system is built up to fight against gravity. So if we don't need to fight against gravity, all our energy can be diverted to something that in that moment is our goal, no? And this is the huge advantage that we can have by aquatic therapy comparing to starting a therapy on land.
Okay, there is a question for sir only. Watsu, any Watsu video, this basic video or anything you can show, sir, if it is available, or you have any link that people can see any kind of Watsu basic videos?
Yeah, a link, you go to watsu.in or to watsu.com, and then you will find information. And about classes in Auroville, Tamil Nadu, you will find it under the Quiet Healing Center .org.in website.
Okay, kindly participants note it down these websites and go that. And I think yeah, it is possible that few of your questions would have missed. So somebody has, I think Manjula has asked about the skin condition. So ma'am, just 2 words on skin condition. How do we go ahead for the hydrotherapy? I mean, for the pool.
With the skin condition, even like I can also go with the question, but yes, since sir is also there across, even he can go ahead with the skin condition. Would you like to, sir, go ahead with the skin conditions question? Because whether it's the hydrotherapy, it's a water shiatsu, or whether it's an aqua fitness or any of the thing with the skin condition, if you have anything which is allergic, you cannot definitely do it, but depends on what chemicals are present inside in the water. Are they using chlorine, are they using bromine, or it's an ozone pool, or are they using alum, or is it a herbal water filter system? So depending on those, it can say. But yes, if you have anything infectious or a spreading skin condition, then definitely you don't want to enter inside in the water and spread that skin condition to the other people. So yes, definitely, sir. Sir, was I correct with the skin condition?
The question was about like a chlorinated water expose. I mean, in the pool, the kind of chlorinated water, how does like how do you deal with that? Like if somebody has a skin reactions out of chlorinated water, like.
Okay. So first, when you take an assessment, you need to ask them whether are they having any chlorine allergy or no. If they don't have a chlorine allergy, then or they don't know, then ask for them to undergo an allergic test. Or if they cannot even go for an allergic test, then ask them to get inside in the water, and you will see, are there any skin rashes they are happening on their body or no. Within few minutes, it will show up. And even depends on what pH level that particular pool has maintained with the chlorine. And you will see some reactions, then definitely that particular person you are not going to advise to get inside. But you can always ask a person to check with his family physician whether he is a chlorine allergic or no, because his family physician will definitely know if he doesn't know it.
What about aqua jogging during some injury to keep up the fitness? Question from Katrina.
Okay, aquatic jogging. Hi, I can see you there. Hi, Katrina. So aquatic jogging during your ankle pain, because depends again with if you are till the neck level, you can definitely go for an aquatic jogging because 10% only of your body weight is going to come on your ankle while you are doing it. But even when you are doing an aquatic jogging, you should not feel a pain. If you feel a pain, then that is an indicator that you are not supposed to do a jogging. And even before you go for a jogging, see some activities like walk, do a brisk walk, do with aquatic fins the exercises, do marching or balance on a single leg and see, do I Chi and check it out. Whether are you having any pain or discomfort while doing that, then only you progress for an aquatic jogging.
Okay, thank you so much, ma'am, for such a wonderful and being patient, like answering almost all questions. Sorry, participants, I have not been able to, I could have missed your 1 or 2 question. Of course, ma'am has, yeah, like how about certification part, like you want to give ma'am or kind of intimation that you have attended this particular webinar, like if you can announce them, like.
Yes, I can definitely announce. Thank you for your participation.
Okay. And we'll have a small like we have a small poll. The thing will come just now. All participants are requested to just do the polling for about 30 seconds, and this is for our internal survey, because we keep working on the ground to take the poll, and then so that we can come up with the best instructor, like Prachi ma'am or Gianni sir. It's wonderful time that you have joined us. Yeah, poll is there. Yeah, time has started. You can just give your feedback. There are few questions, only two or I think four questions. Yeah, please keep voting.
Yes, people are thinking about it, so it's going more than 30 seconds.
Another 30 seconds. I think most of them, they have voted. Another 10 seconds, I believe.
Fine. Shall I end the things?
Yeah, it's almost another 5 seconds, I believe. So and participants, keep in touch with us so that you can come to know, like, because there was a question, I think it was for us and you also ma'am, like when we can have a proper class of aquatherapy after the lockdown. Of course, after the lockdown, be in the touch, and then you will be intimated through your mail that when we have a proper class, then you can book your seat, and we can have, usually it is a 2 days class, as much as I know, that complete your most of the modules. Yes, I think voting is done. Thank you.
Okay.
Yeah, it's done now.
Yeah, thank you so much. Thank you so much,
Okay.
participant, for giving your wonderful vote. It was wonderful to see that majority of people been interacted over video also and given us the excellent mark. Thank you so much. And this whole excellent goes to Dr. Prachi as well as Gianni sir, who has given us precious time today and uh, made our time better. Like, what the weekend can go better than this, that too in the lockdown. Thank you so much, all the participants. Yes, sir. Suman sir, you want to tell something?
Yeah. Thanks a lot, ma'am. Thank you.
Thank you, sir.
Thanks, Gianni sir. Thanks a lot.
Thank you.
There are two questions that I see over here. I
Okay.
would, because they are for Gianni sir, and it's good if he answers them. One question is from Gauri Karol, and she is asking that can Watsu be done for a spastic kid?
Yeah, absolutely. Spasticity is one of the situations that you can treat very well in warm water with spastic people.
Thank you for sir answering that very much. And there are many questions where, like, I see over here who are asking cost of Watsu certification and how do we do it. So you can definitely connect with sir and the website that he has mentioned across. And yes, sir.
It's for Watsu practitioner certification. It needs around 200 hours of classes, and you have to calculate around 500 rupee per hour. It's a step-by-step learning path. It's not that you can in 50 hours be a Watsu therapist. It's a little bit more complex than maybe we can see on a video. No? And Dr. Prachi, I guess she can confirm that.
Yes, definitely. It's not that you have learned a level and just you get a certification. You learn it, you practice it, because each individual is different. And when they come to you, some are really very tight, some are quite flexible and wobbly across when you are holding them inside in the water. So you require a lot of practice. And each year or with each levels, you update yourself. And then, yes, you can go. I am also into the course across. I completed my Watsu 2. Now I'll be preparing myself for Watsu 3. Yes, we can conclude, Dr. Saurabh.
Thank you.
Thank you, sir.
Yeah.
So, Diwakar?
Yeah.
Yeah,
Fine, all fine.
Then,
Thank you, sir. Thank you, madam.
Thank you to all to you for your
and Gianni sir. Then, with your permission, we can conclude today's event. And soon, I mean, let us hope that soon we will catch up each other in a bigger event, that to the physical event, and can learn everything in very practical. Thank you so much.
welcome.